When it comes to toxic elimination from the human body, the liver and kidney plays a vital role. Your health is your wealth and therefore needs to be kept in constant check. Dr. Soliman Clinic and Labs offers you the opportunity to find out about your liver and kidney today. With us, you will have a free liver scan and hepatitis B test by ELISA just at 5,000 francs CFA. Find out the state of your kidney. With us, we offer free kidney scan, and if your creatinine is above 1.5, we have the solution. In addition to that, we also offer free medical consultation and free body scan. We are located in 2 cities. In Boya, we are located at mile 18 Bomaka. In Douala, you can find us at Bonaberry, precisely at Entrepilot. You can also reach us through the telephone number 694-940172. Your health is at the right place with Dr. Soliman.
Welcome back. We talked about kidney stones. Let's talk about the kidney now. How can someone know whether the kidney is good or bad? We talked about the importance of an ultrasound in evaluating kidney. How do you think I send somebody to do kidney profile test and somebody don't send to do kidney profile test? Is what I see in the ultrasound. So beside the ultrasound being very important and number one imaging study when it comes to kidney stone, I can also use the same ultrasound to look at the kidney and see the texture of the kidney. Is it light color or is it dark in color? Comparing it to what? To the next organ. So if we're talking about the right kidney, I compare it to the color and texture of the liver. The kidney is supposed to be darker than the liver, and that's a good kidney. If we're talking about the left kidney, what is the nearby organ? The spleen. So I have to compare the spleen to the next by organ, which is the spleen. So the kidney should be darker than the spleen, and that's a good kidney. What if I look at the kidney and it's very much the same color as the liver, and the other kidney the same color as the spleen? And that was the case, by the way, for that young lady that we have just treated. When I looked at the kidney, I find the kidney same color as the liver. Left kidney, same color as the spleen. It's just that capsule of the kidney that is demarcating the kidney that tells me, hey, this is a kidney and this is a spleen. This is a kidney and this is a liver. That's it. But the color is very much the same. We call that in terminology, in ultrasound terminology, ISO means same, echoic means same color. Same texture, kidney and color. Will be more appropriate to say same color, isoechoic. While the kidney is supposed to be hypo mean less, hypoechoic than the nearby organs, which is liver on the right side and spleen on the left side. Very good. So the ultrasound is also very helpful to tell me, red flag here, send this guy or this patient to do that lab, to do that kidney profile. What were we looking at the kidney profile? We're looking at something called creatinine. That is the easier, approximately accurate, approximately, not 100%, approximately accurate. And I'm gonna tell you how you make this creatinine very accurate for your use as a doctor or as a physician or as a health clinician or health practice. What you do, creatinine coming from where? From muscles. Right? Creatinine coming from muscles. So now, the value of creatinine should be around 1. That is the normal value. Now, if I get somebody who is 100 kilogram and I do his kidney profile, I do his creatinine, and I find it 1.7, 1.6, 1.7. Now I say, this guy has a kidney problem? No, he doesn't. But you just said normal creatinine value is around 1. This guy is 1.7, so he has a problem. He doesn't have a problem. Because we are not computers. We have to factor in that this guy is 100 kilogram, all muscular, lean body mass is huge, so I expect the creatinine to be a bit higher than normal, and that will be considered normal. Okay? A guy, bodybuilder, assuming he's not using any hormones and is all lean body mass, 100 kilogram, his creatinine in normal scenarios will be 1.5, 1.6, 1.7 is normal. Because creatinine comes from muscle and he has a lot of muscles. Simple. Because there is a direct relationship between creatinine and lean body mass. So, on the other hand, if I have, 100 years old lady that doesn't have any lean body mass and the creatinine value shows 0.5, is a red flag? No, it's not a red flag. It is also normal. Why? Because she doesn't have the lean body mass. And what else? Because she is old. And there is an inverse relationship between age and creatinine. So as the age advances very high, I expect the creatinine value to drop below the 1. So now we have to adjust our thinking and evaluation of creatinine to evaluate correctly based on other factors as well if I'm going to use creatinine as a parameter. Now we have equations to tell us what is the filtration rate, glomerular filtration rate, which you don't need to know. All you need to know here in these sessions is advice how to prevent a disease, when you should go to the doctor, have a general health education about your body. That is the purpose of this program. So we rely on creatinine. Creatinine is directly relation to lean body mass and inversely relation to age. So we give the two examples and we understand this is about creatinine. Now, we had patients with stones, we drop the stones. As far as the treatment, we drop the stones. Inshallah, we drop the stones. We have our own approach. We follow the protocol also that is by the Urology Association, Medical Urology Association, but there is also other things that is being done, okay, that help drop the stone. That maybe, few people use it and it works beautifully. If Mr. Johnson have that video with that guy with the kidney problems that we have taken care of, maybe it's time to play it, and then we'll have a couple of comments about that video and discuss the case of that guy. You tell them in your own word now. How much was your creatinine a couple of weeks ago?
I arrived this hospital 2 weeks ago and my creatinine was 13.9. And I was told my kidney has failed.
Yes.
That is total failure of the kidney.
Yes.
And after 2 weeks of treatment, I did a test yesterday and it is 1.4. 1.4.
The test today
1.4.
is 1.4 for creatinine. Congratulations.
Thank you.
23rd of November, creatinine was 13.9.
Yeah.
We'll give you 2 bottles of gum, right?
2 bottles of gum.
2
yeah.
bottles of gum.
2 bottles of gum.
Right.
Yeah.
And how much is your creatinine today? Creatinine today is 1.4. Back to normal.
Very good.
Yes, we thank God.
Thank God.
2 bottles of gum, finished. 2 weeks, right? How long did you take it for?
It's 2 weeks.
2 weeks.
2
From
weeks.
13 creatinine
Yeah.
to 1.4.
1.4.
Excellent. It's no secret how we reverse the kidney function. It's a raisin that grow in big old trees, specific raisin. 2 of them, we mix them together with a specific percent. How many to how many? How many grams of this to how many grams of this? Virgin olive oil, virgin coconut oil, virgin sesame oil. When I say virgin, that means it has not been treated with sodium hydroxide. This refined, nice looking oil that you see in the bottle coming from United States or coming from Europe is not the one. You cannot use that. It may look good, but it's not the one because it has been chemically treated. We don't want that. When I talk about virgin oil, we're talking about a seed that you squeeze and the oil comes out of it. Cold press will be better. That's what that's what we talk about virgin oil. Why I'm using virgin oil and I'm not using that fancy looking bottle coming from Europe or USA? Wow, very expensive, because it doesn't have any value to me. It has lost all its antioxidant value. What did I say? Oxidant, antioxidant. So we have oxidative molecules, toxins. When we're talking about oxidative molecules, we're talking about toxins that has caused the kidney, like exactly like your drainage at home. Doesn't it sometimes get clogged up, and it doesn't function anymore, and the water backs up and is no more good? The shifter has gone bad. Pretty much the same thing. Toxins, too much toxins, and inability to eliminate those toxins get to the kidney. So the treatment will be eliminate the toxins and give the kidney room to breathe and comes back normal to its function. So when we talk about we talk about olive oil, but you cannot take olive oil by itself and expect the kidney to be fine. It's a formulation that has to be done, certain percentage mixed with that resin, and then the kidney is back to normal. Everything is supported 100% by research and results and conclusion. Not talking from my head. We're talking based about research, positive results of the research, and no side effects. You see, we're going to talk about side effects because I cannot be treating the kidney and damaging something else. Like we're going to discuss later on in the show today about somebody treating the liver but damaging the kidney. We cannot do that. We have to consider what is good and what is bad, and this treatment has no side effects, only positive, alhamdulillah, and it reversed the kidney. It reversed the guy, creatinine, from 13.9 to 1.4. He still have to lose 0.4, you know, so, but he's good. Because if you look at the guy, he's about 80 something kilograms, and he's about lean, he doesn't have much fat. So 1.1, 1.2 creatinine value is okay for him, is the normal value. Who would believe after 2 weeks, a guy that was subject to, okay, now you only gotta go dialysis, and after 2 weeks, he's happy. Didn't go dialysis. He got cured. The kidney function was reversed back to normal, which we thank God for that. Is absolutely God's work. I'm just a tool. So now, let's talk about now things, when we talk about the kidney, it's a bit complicated. We're going to be talking about metabolic acidosis. But before we talk about metabolic acidosis, what is metabolic acidosis? Meaning the blood become acidic. When the blood become acidic, it is bad. When the blood become acidic, is bad. And the blood can become acidic not only because of the kidney. The blood could be acidic also because of the lung disorders. Let's see how. If you have any situation that causes you to hypoventilate, hypo mean less, ventilate meaning you are breathing less. Any situation like a brain lesion, for example, like any lung disease, for example, that causing you to breathe less. Breathing less meaning what? Meaning you are not, blowing off carbon dioxide. Carbon dioxide, without going into a lot of chemistry and complication, carbon dioxide should be considered in your head as acid. Okay? Because it's carbonic acid. Anyway, carbon dioxide is acid. So when I'm hypoventilating, I am not blowing off carbon dioxide out to the air. I'm retaining carbon dioxide inside my body. I become acidemic. So that is because of respiration problem. Now I call that respiratory acidosis. I become acidemic because I cannot blow off carbon dioxide. On the other hand, if I have any situation with hyperventilating, you are hyperventilating mean hyperventilating. If you have any situation that can cause hyperventilation, let me give you an example. You're anxious, you're afraid, you're scared, and anxiety is high, you hyperventilate. So what does that mean? you're blowing off a lot of CO2. That means you lose an acid. That what's to happen is going to have alkalosis. Then you're going to have respiratory alkalosis because it's all about the lungs that cause the alkalosis. So we call it respiratory alkalosis. So this is quick to understand about alkalosis versus acidosis when it relates to the lungs. But believe it or not, the kidney does the same thing at a much higher level. So when we have acidosis in the blood and the lungs or the brain is not the cause, we think about the kidneys. So the kidneys can kill you by means of acidosis. That is why we revert to dialysis. Because I don't want to die. I don't want to go into severe acidosis, metabolic acidosis, and go in the ICU and go in confusion, and acidosis is bad. Okay, so kidney is responsible for something called acidosis, mean acid in the blood. This is acidosis. Now, for example, we have RTA. Okay, RTA meaning renal tubular acidosis. Acidosis because of the kidney, and they are types. Let's say, as the kidney has proximal parts and distal parts, because the kidney is about nephrons. The building unit for a kidney is a nephron, and it has part. One part we call proximal, and the far one we call distal. If the problem happen in the distal, there is a problem in the kidney that is affecting the distal part, we call this one RTA1, type 1, or RTA distal part. What's going to happen? We're going to have hypokalemia in the blood, because most of the potassium now is being dumped out because of that distal part become leaky, so it's leaking out potassium, so we become hypokalemic. What if the problem happened in the proximal part of the nephron in the kidney? Then it's the same thing. It becomes leaky, so it leaks out potassium. So whether it's type 1 or type 2, both of them leak out potassium. Both of them will have a condition called hypokalemia. Hypokalemia meaning the potassium inside your blood becomes low. Is potassium important for you? Absolutely. Without potassium, high potassium, low potassium, you get a lot of problems. So the potassium has to be normal. How we differentiate between type 1 and type 2? Type 1 is easy. Okay, you lose a little bit of potassium, which is the distal one, and that's it. But the proximal type 2, that's a bit more dangerous. Why? Because when the proximal part gets affected, you're not going to only leak potassium, you're going to leak glucose, you're going to leak calcium, you're going to leak other stuff, important stuff for you. So when you come to me and you tell me, listen, doc, I go to the bathroom 100 times a night, it's because the urine now having a lot of glucose. And when glucose increase to above 300 mgdl, then you tend to go to the bathroom a lot, because now the glucose is working as osmolarity force that draw water into it, and now as a result you go to the bathroom many times. You're not diabetic, but you're acting like one. You're not diabetic, but you're acting like one because of the bad kidney. We have RTA type 2, renal tubular acidosis type 2, that affect the upper part of the nephron in the kidney. So we discussed about the upper part. I mean, there's a lot more to it than just that. I'm trying to make it simple. So we discussed the upper part of the nephron, the proximal part, and what happened, the lower part, and what happened. Both of them hypokalemia, but the type 1 might find glucose and calcium and other electrolyte in the urine as well, because it becomes leaky. So type 2 is a bit more dangerous than type 1. So if you come to me complaining that you go to the bathroom many times a day and you're not diabetic, I have to check the kidney. Might be RTA type 2, renal tubular acidosis, or a problem with the kidney at one of the parts of the kidney. There's type 4, but there is no type 3. Funny. This is how they classify it. Anyway, we don't worry about the types. I want to tell you about the symptoms. And this type here, the last type, is very much unique to diabetic patients. So if you are diabetic and you're not controlled, most likely you have the kidney problem. We call it diabetic nephropathology, or the kidney became sick because of the diabetes by a process called hyalinization. So that the kidney, some kidney parts become bad because of the diabetes. So as long as you are not controlled, we have a problem. What if you are controlled and have a problem? I still have to look at the kidney. It is very tricky, but the kidney is being affected when you're not controlling the blood pressure. Now, what is different, what is unique about this type of RTA, or renal tubular acidosis, compared to the other two? This one will have rather hyperkalemia. Hyperkalemia meaning high potassium in the blood. Say the other two types were losing potassium to the urine, so as a result the blood will have low potassium. This one here is holding on to potassium, meaning the blood will be rich in potassium. It's not leaky to potassium. It is holding on to potassium, so the blood will be very rich in potassium. Is this bad for the health? Absolutely. Hyperkalemia can kill you by heart attack. So, if you are diabetic and you have high potassium, is a problem. Check your kidneys immediately. You may have type RTA type 4, renal tubular acidosis. That is bad. Now, but there is a trick here, because we have to be complete when we discuss things. When we are talking about a diabetic patient normally have high potassium. Let's say potassium is from 3.5 to 5.5. I expect my diabetic patient to be at the 5 area, 5.5. But if it goes to 6, 7, then we have a problem. This is what is called hyperkalemia. And now I'm thinking about, since my patient is already diabetic, then I'm thinking about renal tubular acidosis. We have acidosis in the blood because of that, and also hyperkalemia. Because very much, hydrogen and potassium, they are closely associated. When we have a patient with hyperkalemia, the chances are he's also acidemic, because the H+, which is responsible for being an acid, is high. So how we do that? So you're not going to be doctors, okay? I'm not expecting you. But I wanted to stress out one point. Like we said when the urine with the stones, when we said urine must flow, you cannot keep urine. The same thing, we have to have a rule here. If you are diabetic and you do the potassium and is high, it's the danger zone. So potassium has to be okay. I'm expecting potassium to be high normal, 5.5 if you're diabetic. Why? There is a reason for that. When a diabetic means that you're not secreting enough insulin. What is the function of the insulin? Two things. It brings the sugar inside the cell, so the cell can use it and utilize energy. And it brings potassium inside the cell. So this is the cell. Outside my hand is the blood. So now, the potassium will enter the cell, leaving the blood, making the blood less potassium, the cell more potassium, and that is the normal. If insulin fails to work, then nothing to bring my potassium from the blood inside the cell. As a result, we'll have high potassium. But I'm taking insulin, I'm taking some oral medication if I'm type 2 diabetic. Then what? Then, well, the potassium will enter, but it's not as if you are a normal person. Some of the potassium will still be high outside in the blood. So as a result of that, I expect any diabetic patient the potassium to be a little bit high. 5.5. So when we have a patient that has a problem, diabetic ketoacidosis, what we say here? Acidosis, acidosis coming from the, you will find the potassium also high, because there is acidosis. Okay? So now, if I fail to take my insulin, or ignore taking my insulin, or ignore taking my diabetes drugs, then what do I get? The insulin is not there, or the cell itself of the human resistant to the insulin. In both scenarios, I am not getting insulin to be secreted, or I'm not getting insulin to work. Those are the two types of diabetes. Either no insulin, or there is insulin but it's failed to work because the receptor is bad. So in both scenarios, the glucose is not going to enter the cell because it needs insulin to enter the cell. And at the same scenario, potassium will not enter the cell because I need insulin for the potassium to enter the cell. So I'm going to end up with what? Hyperglycemia, hyperkalemia, or high potassium in the blood, high glucose in the blood. Solution is what? Get rid of the potassium, get rid of the glucose. How we do that? Well, there is a protocol. We infuse a lot of normal saline to get rid of as much sugar as we possibly can, and then we do the cocktail, which is a little bit of potassium. You have to give potassium when you give insulin, because otherwise the guy is going to go hypokalemic on you, and that's going to be a disaster. Because when you treat diabetic patient, you have to know that you cannot drop their potassium because they are used to high potassium anyway. The diabetic for many years, so we cannot drop the potassium below 5. Okay, that is the cutoff. We cannot drop potassium below 5. All doctors who are dealing with diabetes know that very well. So, but for you as a patient, if you're diabetic, we're gonna have special sessions on diabetes, and we will be talking about it a lot, and we'll understand it. But now that we're talking about the kidney, I have to make you understand the relationship between diabetes and the kidney. So the diabetes can cause kidney problems, and it will be associated with RTA type 4, or in other words, the hyperkalemic kind of nephropathy. Hyperkalemic meaning the potassium will be high in the blood, and hyperkalemia follows with acidemia. So that's what we call acidosis. Acidosis, remember we're talking about acidosis. Acidosis, hyperkalemia, and we talked about acidosis, hypokalemia in type 1, type 2. Let's take 1 minute break, and then we'll come back and we'll talk about something different. I'm quite sure you are tired of listening to kidney now.